Well, welcome everyone. Thank you for joining us this evening for our special edition of Webinar Wednesday. Today's series is on COVID-19, dealing with anxiety in today's COVID landscape. My name is Sarah Kurtz, and I am the Programs Manager here at Can Do MS. Our panelists tonight will provide a comprehensive overview of where we are now with this virus. And as a reminder, you can ask questions through the question box found on your control panel, and the webinar will be recorded and available on our website by the end of the day tomorrow. So if there's anything you want to revisit, that will be made available to you. So at this point, I'm going to kick it over to Kathy.
Thanks so much, Sarah. Welcome, everyone. Gosh, who knew in March of 2020, when this all started, that in August of 2022, we'd be choosing this as the topic for our special webinar. I'm sure all of us thought that we were going to be long past this and back to our normal life. But what is that now? We're still coping with this. We still have challenges, fears, loss, and the changes in our life due to this, due to COVID-19. And because of these issues, as well as the virus persistence, it's important for us to reconvene and bring this panel back together and provide an update. So your panelists are not only in front of you, but on the screen, on the slide as well. And as a reminder, since we've been here before, I'm a nurse practitioner. I've been involved in MS care for a long, long time, and now lead our work in programs here at Can Do. And as reintroduction, Roz Kalb is a clinical psychologist. She's an author of several books about MS, lots of different articles, and she's a senior program consultant at Can Do. And Dr. Nancy Sykott is the director of multiple sclerosis at the neuroimmunology program at Cedars-Sinai, and also the chairman or chairperson for the Department of Neurology at Cedars-Sinai. And in addition, she also chairs the National Medical Advisory Committee for the National MS Society and also the COVID-19 Advisory Group for the National MS Society. So clearly a very important person in the world of MS, but specifically for our panel tonight. So I'd like to welcome you both, and thanks again for reconvening for this topic. So on our next slide, I believe are our topics for this evening. Where are we now? What's happening? What are current management strategies for COVID-19? How do we balance safety with actually living a full life? And can we get back to that? How do we develop a plan and manage these risks? And how do we move forward? So we're going to be talking about lots of things. We welcome your questions. And in fact, before we actually get started with our part of the program, we'd like to hear from you. And we have two polling questions. And here is the first. And what is on the top of your mind about COVID-19? And please select all that apply. Isolation, vaccines and boosters, variants, MS medications and COVID. And if there's something else, please type it in the chat box. And we'll give you a few moments for that. Wow, it's pretty evenly spread across all topics related to COVID-19.
No questions or comments in the chat.
All right, and one additional question, and I'm sorry, my box here is in the way. What concerned you most about the current COVID environment? Please select all that apply. And again, if something is on your mind that's not here, please go ahead and put that in the box. Getting COVID again or for the first time, getting long COVID, feeling safe outside of my home, my kids returning to school, getting medications to prevent or treat COVID. Okay. So again, a lot of people worrying about getting COVID again or for the first time. Long COVID is certainly a concern. That safety issue, yeah, less for the children returning to school, but getting medications to prevent or treat comes up a lot too. So hopefully we'll get to some of these topics as well this evening. All right, so now I'm going to get to ask a few questions here. So for the first question, you know, pandemic, endemic. Nancy, what are the differences and where are we? Is this still a pandemic? Is it now just something we have to live with, or endemic? Help us out with defining where we actually are in this situation.
Yeah, it was a great question, and I could safely say that we're not where we thought we would be more than 2 years in. I think we've learned that this virus has its own plan, and it doesn't go by the usual rules of engagement. And we were joking before that we're in an endemic pandemic or an endless pandemic. So pandemic means that there's widespread transmission of a pathogen across the globe. And I think that we could safely say that we're still in a pandemic. But what we've seen is there are areas where it's flares up and is much more active, and then other areas where it's not. And then I think what we're seeing now is sort of this steady state where there's ongoing transmission, there's ongoing, people getting sick, but we're neither, in a surge or at zero. So I think we're approaching what we might call the new normal, which is it's not gonna go away. We're gonna have to learn to live with the virus. I think that's pretty obvious now after all this time. Many of us, I'm sure, had this idea that if we all stayed home for 2 weeks, it would go away and die out, and that's clearly not the case. The virus is very resilient, and it is transformed and mutated and has made itself very, very easy to catch and transmit, and so it's evolved to be a tenacious virus. So I think it's one of these things that we're just going to have to live with. And so I think this webinar we're doing is really timely because we're going to kind of talk about how do you live with something that we've spent 2.5 years being terrified of.
Yeah, and I think some of that terror is still there. And with the current variant, and of course it will likely change as the seasons change and as the virus evades new techniques, but is the virus becoming less virulent? Is it causing less severe infections, or is it still affecting people who have certain risks more than others?
So it certainly seems as though the Omicron variants are less virulent in the sense that we see fewer people who end up needing to be on ventilators or get oxygen support or even get admitted to the hospital. So it's a little bit confounded by the fact that many people are vaccinated, or have had COVID previously. So those factors make if you get an infection, less serious. But even so, there's definitely a sense, if you look at the numbers and the surges, and then the people who have the Omicron variants and the people who end up in the hospital, it's very clear that these new variants are clearly more transmissible, but they seem to be less lethal. And certainly, fewer people are getting sick enough to end up in the hospital. But that said, there are still people who get hospitalized and who die from COVID, and that continues to happen every day. There are people dying. Fortunately, it's not in the staggering numbers that we were seeing during the earlier Delta surges.
Yeah, so as follow-up to that, what does this mean specifically for people with MS? Are they at greater risk, not only for getting COVID, but for poorer outcomes? So those fewer people, but those people who have those more severe cases and may have poorer outcomes.
Well, the good news is we have a lot of data on this now to be able to answer those questions, and it's very clear that people who have MS are no more or less likely to develop COVID than the general population. So there isn't anything about MS per se. We do also know that people who are treated with certain medications may have a more severe course of COVID if they happen to get it, and that would include medications, especially the B-cell depleters like rituximab and ocrelizumab. Now, To be fair, those were data that were developed during the original Alpha and Delta surges, and we don't have equivalent data for Omicron. And again, the impression is that they're less severe. But the thing that is the most important in terms of risks are being unvaccinated in this day and age in terms of getting severe disease or even getting sick. We think that being vaccinated obviously gives you, doesn't prevent infection, but can decrease your likelihood of getting infected. But also the other comorbidities are really seem to be still, we know from the beginning, driving bad outcomes. So people who are older, who have hypertension, diabetes, obesity, underlying pulmonary disease to start with, these are the people who have a much higher likelihood of ending up in the hospital and having severe COVID.
Wow. Thanks for that. So what about long COVID? So is there anything that we've learned that predicts long COVID, and is it more likely for people with MS to develop long COVID?
So this is an emerging field and the data is not complete, but there is some suggestion that there could be an increased risk of developing long COVID if you have an underlying autoimmune disease. So that has been some evidence to support that. Women seem to be a little bit more likely to develop long COVID as well. But again, these are the initial data that's coming out, so it's not hard and fast at this point. We're just starting to learn how do you even define long COVID. And so there's a syndrome now, or a nomenclature called PACS, they're calling it post-acute COVID syndrome. And there seems to be different varieties of that. So not everything, it's very hard to talk about long COVID in general, because there's a lot of different variations of it and so forth. But I think what we all mean when we say long COVID is, it's bad enough that you got the infection, but now am I going to have weeks or months of not feeling right and not being able to get back to my usual state of health? So theoretically, if you have MS, you have an autoimmune disease, so there could be an increased risk of developing long COVID. But again, I want to emphasize that these are sort of early days in this understanding. And then in terms of who's at risk, you might think the more severe the COVID, the more likely that you would go on to develop long COVID. And that doesn't necessarily seem to be the case. Now, certainly people who are hospitalized, ventilated, spent a lot of time in the ICU are going to have a lot of recovery after that. So that may be different than, just sort of this long COVID, which is you had your infection, you got over it, but now you have these new symptoms or these lingering symptoms, some autonomic dysfunction or brain fog and so on. And so I think those factors, we're still trying to figure them out. So it doesn't necessarily correspond to the course of of the COVID infection that you had. Now, of course, the best thing to prevent long COVID would be not to ever get COVID. But also, I think we have to, and so then that's probably going to tie into some of the other things we'll talk about, this fear of getting an infection with COVID because of this fear in particular. And I think we saw that in the polling of developing long COVID. So I think the best protection against that is still vaccination. Obviously, avoiding getting infected, but vaccination to prevent severe infection, and also maintaining your own health so that you're able to have a good response to the infection and recover quickly. But I don't want to sugarcoat it, because the truth is we don't really understand all of the factors that lead people to develop long COVID.
Yeah. Is there an end? I mean, I know it's long, but is there a time frame that it lasts? Is it 6 months, a year? Is there an average, I guess?
Yeah, no, I think it's encouraging, at least in the cases I've seen and the data that I've seen, that this is something that does get better over time. Now, it may not be as quick as you would want it to be, but certainly we're seeing that 3-6 months after infections, the vast majority of people who've had more extensive, long-lasting symptoms are feeling better and are doing better. There is a small minority of people, or there, given the numbers of people at risk and who've had it, it's still a large number, but percentage-wise, most people are going to be feeling better within that 3 to 6 month period. It's the folks that are going out now 9, 12, now some people even 2 years, who are still symptomatic, or that are the real concern, and honestly kind of head scratchers as to why this is lasting so long.
Yeah. There's a couple of questions in the box about Evusheld. And should people get it, particularly if they're on the B cell depleters, or aside from that, should people with MS be getting this drug?
So first and foremost, if you are on a B cell depleter, yes, you should get Evusheld, B cell depleter or S1P inhibitor, so like fingolimod or pasanamod, that family of medications. Not everyone is eligible to receive Evusheld, so just having MS, if you're on one of the other disease-modifying therapies, does not qualify you to get Evusheld. But for those individuals who are on those medications, also they use it for people who have cancer, who are on chemotherapy. So if you had a bone marrow transplant, or a patient living with MS who had that kind of treatment, you would be eligible. So we very much encourage our patients to get Evusheld, and we've had over 70 or 80 of our clinic patients who have gotten it. We have a process where we can't just order it. It has to be submitted to our pharmacy, and it has to be approved by pharmacy. So all the B cell depleted patients don't have a problem with that. And then the Evusheld is administered in an outpatient setting at one of our urgent care places. It's one shot in each arm, 2 different monoclonal antibodies. And importantly, this is pre-exposure prophylaxis. So you get this medication, you get this antibody treatment, these injections, to prevent you from developing COVID. So I think this has been a really important factor in helping especially our B cell depleted patients feel more confident to get out there and get out in the world. But also, it's not 100%. I had one of my patients who came back and said she got COVID after she had Evusheld, and she thought that she was really annoyed because she thought it meant she could never get COVID.
Right.
But so it's effective about 90% of the time, but we've definitely seen about 5% of our patient population with breakthrough infections, even though they've been vaccinated and they've gotten Evusheld, they still end up with COVID. But again, I want to emphasize, at the early stages of the pandemic, we probably had 4 or 5 of our patients who ended up being hospitalized with COVID. Since then, we've had hundreds of our patients get COVID, and none of them have been hospitalized. And we have a lot of people who are on B cell depleters. So I think that makes me also feel like this Omicron is not so severe. But anyway, I definitely, for anyone who has a question about Evusheld, ask your neurologist or your healthcare provider if you're eligible, and if you are, you should get it.
So it has a period of time that it lasts. Can you get it again?
Yes. So the recommendation is every 6 months.
Okay.
There could be data and a change in that to every 4 months, but my understanding right now, it's every 6 months you're eligible to get another shot of Evusheld.
Great. Thank you. So when people have to go back to work, their kids are going back to school, someone in the home is going out to work and coming back in, what are you recommending to your patients with MS to avoid getting something they're bringing back to the house?
So I think this is a really hard one because people who are going out of the house and going on with their usual activities are going to get exposed. So really what we have seen and what we know is that using masks and taking precautions makes a big difference. So my recommendation for my patients is for them personally, if they're going to be out and they're going to be in an enclosed area like going to the grocery store or going to the bank, that they wear a mask. So wearing a mask indoors. And even sometimes, keeping your mask on if you're standing in a crowded area, even if you're outside, because this Omicron is so catchy. We think that, if you're really close to someone for a period of time, even outdoors, you might be able to catch it. So masking is, I think, one of the big first lines of defense. So that actually extends to the other people who you're living with. Sort of everybody has to take those kind of common sense precautions in order to protect the other people that are in the house. But it's a tricky one. And most of the cases I've seen in my patients, they are not the vector. It's usually a child or the 20-year-olds for a while. They were the ones who threw off their masks and went out and went to visit, the family. And so it's a tough one because you can't necessarily control everyone else's behavior.
Yeah, that's very true. So, but taking these precautions that we've actually been taking for a while are still important, and masks really do work. And there's certain types of masks that work better than others, right? So your N95, your KN95, or double masking seems to work better than just using the procedure masks, the kind of paper masks, or just a single cloth mask. So it should be those first that I mentioned, correct?
Yeah, so my recommendation, definitely you want a high quality mask when you're in a place like an airplane, where I know that they talk about the air filtering systems, and the truth is those do work really well, but they don't kick in until you're at 10,000 feet. So up until that point, when everybody's walking in and out of the plane and people are eating their food that they brought in and so forth, that's the potential risk. And a lot of people are out traveling, and masks are not required now, as you know, on planes. So I definitely recommend wear a really high quality mask when you're in an enclosed space like that for a period of time. So wearing KN95s are great, and if they're comfortable, we use paper masks here, but I'm just on service now, so we have COVID patients in the hospital, so we're putting N95s on when we're doing that. So it's almost like you have to titrate your protection level based on what you think the risks are. Which is we have to negotiate this new reality.
Yeah. So you mentioned a little bit about boosters. And so in the news, there's another booster coming out probably in October. And the exciting thing is it's actually going to be effective against original COVID, but also the newer variants, the Omicron BA4 and BA5, which is very exciting. But for people who are due now, okay, so either they're due because it's been more than 4 months, or they're at that point in their treatment, for instance, their B-cell depleter, like their Ocrevus or Rituxan treatment, and it's a good time. Do they wait and get the new and improved booster, or do they just go ahead and get the booster and then get the new and improved 4 months from now? What cadence?
I think you know what I'm going to say, Kathy. If you can get it, go get it. If it's the right time, don't wait. And in particular, it's the summer. People might be planning a trip. So there's no advantage to waiting. We know that the booster is due to come out in October, but it doesn't mean that it'll be instantly accessible. It'll probably go to healthcare providers first. I don't know what the supplies will be like. Hopefully we've learned our lessons there. But I'd say, if you are at a good point to get your booster and you haven't had one in more than 4 months, or you're going to be doing some traveling and potentially be exposed, that you should go ahead and get the booster now, and then certainly we'll want to get the booster in the fall when we've got the added protection against Omicron variants.
Yeah. There's just a few questions, so before I move any further, I want to tackle some of these. People are wondering about an MS exacerbation or just their MS symptoms worsening if they get COVID. So aside from just the symptoms of COVID or long COVID, what's happening with their symptoms of MS?
Yeah, so getting COVID when you have MS definitely can put you at risk for having what we call pseudo relapses. So that's when you get a high fever or you're ill and it sort of revs up your immune responses and your old symptoms recrudesce or get worse. And we definitely have seen that happen, and that even can happen when you get vaccinated, right? Because when you get vaccinated, you have this transient, maybe a little fever, maybe a little increase in your immune responses. But so that is, not uncommon, and so people should expect that. So you want to manage your fever, take analgesics and make sure that you're keeping your fever down. In terms of triggering a relapse, we do know that there's a slightly increased risk of a relapse after a viral infection, which is why we recommend that people get flu vaccines so that they don't get the flu. So same thing with COVID. I haven't seen a lot of data on that, but in my experience anecdotally with our patient population, we haven't really seen that. But it's theoretically possible that you could trigger a relapse after having COVID. But much more likely is that pseudo relapse, which is not, should go away as you get better and your fever comes down and so forth.
Yeah. A couple of people have asked about how they feel after they get their vaccine. That seems to be giving them that pseudo relapse. And I've heard that before, that after getting a booster, people are down and out for, 4 or 5 days or more. And what would be your recommendation if someone is having kind of that, almost like a pseudo relapse, but they might have a little bit of fever and that achiness and fatigue? Would it just be over-the-counter analgesics and it will tend to settle down?
Yeah, I think that's exactly right. You obviously, if you've had that kind of reaction before, then I would say just plan accordingly so that that it might, take you down for a day or two. 4 or 5 days would be a lot. I've seen people maybe a couple of days, but I think just recognizing that that's a risk, especially if somebody lives with progressive disease and has a lot of difficulty walking, that little pseudo relapse might be enough to put them over the edge, so they really have difficulties getting around, and then they might want to have some help available, maybe just plan ahead. But even though that sounds, the idea that you might have worsening symptoms for a few days sounds bad, much better that than getting or having a bad infection with COVID. And we do think that the risks far outweigh, or the benefits of the vaccine far outweigh the risks of the pseudo relapses and so forth. So yeah, it's just a matter of managing those, lots of fluids, the usual things, and then maybe having a friend or a family member give you some TLC while you're going through that.
Yeah, great.
Wearing a mask.
Wearing a mask. Yes, exactly.
So I'm going to actually, Roz, want to make sure we're not leaving you out of this conversation because you have a lot of things to contribute here. So, helping people with MS stay active. We want people to connect with.
I'm going to step in here because we've lost Kathy for a minute. So what Kathy is going to ask me is about how do you balance being careful to protect yourself against COVID, but also doing the things that we know are so important for your wellness, like getting out, being active, connecting with people who are important to you, and doing the things that have meaning in your life. And I think for all of us, we've discovered it's a bit of a balancing act. I am committed to staying safe. I still wear masks in all those environments that Nancy has described to us, in crowded places, and I stay outdoors, but I know that it's important for my well-being, and I know it's important for yours to also live your life. And so I think we are always, all the time, balancing the benefits of staying engaged with our world and trying to be as protective of ourselves as possible. What that means sometimes is I go into a place wearing a mask and I'm the only person wearing one. And sometimes people look at me funny, or sometimes people roll their eyes, but you know what? I don't care. I'm doing what I know is good for me. And that's sort of how I want you to approach this. You in your family decide what strategies you are going to use to keep each other safe. And then you kind of make a pact. This is what we do. It doesn't matter what other people are doing or what they say. You make it your normal. And once you come to that confident belief that you're doing the right thing for yourself, I think it makes it a little easier to go about your business. Now, I know that I've heard from Nancy that she has patients who are just afraid to go out. This has become such a frightening specter over the last couple of years. And I certainly get that, but I think we have to take the wonderful information that Nancy has given us tonight and recognize that there is a lot that we can do to protect ourselves. We can't protect ourselves 100%, but now with the vaccine protections that are available, the Evusheld that's available for some people with MS, and the treatments that are available, which we'll get to in a minute, the risks of cutting yourself off from life may be more impactful than the risk of getting what might be a not very serious case of COVID if you use all the protections available to you. So I would urge you to change your mindset a little bit, to think about how you can get out into the world to do things that are important to you in the safest way possible. Pick a couple of things that are most important to you and give it a try. Because sometimes once you've stuck your toe in that cold water, you'll say, okay, I really like being out here in the world again. Let me take another step and another step, okay? And I would also encourage you, if you're finding yourself overwhelmed with anxiety about this, that you really feel kind of locked in by this anxiety, this is a very good opportunity to talk with a mental health professional just about anxiety management strategies, right? Because sometimes the anxiety becomes a problem in and of itself, preventing you from doing things. So it's not the COVID, it's the anxiety about COVID, and talking with someone can be very, very helpful in terms of learning how to manage that. But I mentioned before that now we have some things that you can actually do if you do get COVID. So I have a question for you, Nancy, and that is, so what do people need to know? What's the first phone call they make if they get symptoms and test positive for COVID and they're living with MS? What do you want them to do right then and there?
So great question. We definitely recommend that our patients contact their primary care physician, because these are the folks who are got all the bells and whistles. They deal with this every day. That said, they usually call us first, because we kind of function as primary care physicians for a lot of our patients. So we definitely encourage our patients, especially those who have comorbid conditions and who are eligible, to seek out therapy. So there are treatments, in particular Paxlovid, which is the oral medication that can really shorten the duration and the severity of COVID. It has some issues related to interactions with medications. So we are typically wanting to do that in conjunction with the primary care physician. And also now the pharmacists are quite adept at doing this. But I would say they should reach out to their healthcare providers, including their PCP. And then obviously we want to know when people are having issues to help them manage through that. But it is, as you were saying and alluding to, I think, Raj, you made some really good points about this is kind of moving into one of these manageable conditions, right? It's not something you want to seek out. Nobody wants to run out and get this. But if you do happen to get it, it's manageable. And we were talking about this before the onset, and I'm really amazed to see 75% of the folks, well, I guess we said again or for the first time, but only about 18% of the US population has not had COVID, at least that they know. I think if we did antibody testing on that 18%, we might find it's even less than that have not had COVID. So the truth is, the vast majority of people who live in the United States have had COVID at least once. And as we've talked about, this is now becoming one of these manageable, but, not something you want to get, but manageable kind of infection. So I think, as you said, we have to start readjusting our thinking about it. I think our MS patients are so good about listening to medical advice and taking it in and being informed. And the thinking about it, it was just, we're kind of fixed. Some people have gotten fixed in that anxious stage, the first stage, which was terrifying and entirely appropriate. But I think it's now we're moving into another phase where it's still, a little scary, but it's a manageable situation, and we have to reinforce that.
Well, it's definitely reassuring to hear that from you. I feel better. So Kathy, as COVID becomes more a part of our daily life, it's going to take on more and more similarities to what we live with all the time, like flu and colds and other things. So could you just re-emphasize, because we've mentioned it once tonight, but re-emphasize what you have recommended for your patients living with MS about how to protect themselves against those everyday concerns? Because, by the way, flu can be pretty dangerous. So, what's your recommendation about that?
Yeah. Well, thanks for that, Roz. And I think in terms of flu, honestly, the most important thing to do is to get the flu vaccine every year. And, other vaccines, particularly as some people are getting older, there's also the Pneumovax or the pneumonia vaccine. And I think it's important to get these vaccines because these illnesses can be really serious. We don't think about them as much because all that we've been thinking about is COVID, of course. But these can be serious in certain populations as well. And, there are other strategies. We've talked a lot about how to protect yourself if you have to go out or if people are coming into the home. Then I think that, the mask wearing when we're indoors and in enclosed spaces is very important. We used to think that masks very early on, that the only reason you wear a mask was to protect somebody else. But, these masks that we're talking about now is a two-way street in a way. Right? So you really want to protect yourself, and a high quality mask can help with that. They are very, very effective. And so wearing something that is highly effective when you're out and about is important. I think some of the wellness strategies are important as we have to deal with these infections, right? So when we're depleted, we're not going to handle an infection as well as we would if we're at our best. What do I mean by that? Getting a good night's sleep. And if you're not getting a good night's sleep, investigating that so that you can. There's lots of reasons why people don't sleep, but sleep is restorative and it helps keep us at our best. The other thing is what we eat. We truly are what we eat. And so when we eat a very healthy diet, we are overall healthier. It doesn't mean immune boosting foods. That's not what I'm talking about. And in fact, some people would argue that's not good for people with MS. But I think eating those whole grains, fresh fruits, fresh vegetables, lean meats, and keeping to the eat real food, eat less, and eat more plants. That's not my line, that's Michael Pollan's line, but I try and live by that. But these strategies, they seem so simple, like, oh, come on. This is serious. These are things that really do help people stay at their best. We're at risk out here, whether it be COVID or flu or something else coming along, we have to be prepared and be at our best in order to manage these things.
So an important question came into the chat about the shingles vaccine. I don't know which one of you wants to talk about that, but I know people with MS wonder whether the shingles vaccine is a safe vaccine for them to get.
Go ahead, Nancy.
Yeah, no, I want to, and I'd like to hear your take on it too, Kathy, but absolutely the new vaccine, the Shingrix, is not a live vaccine, so it's definitely recommended for people who live with MS. In particular, some of the medications we use to treat MS can make you a little bit more prone to developing shingles. Shingles is painful and, sometimes leaves disfiguring changes on the skin and so forth. But so we want to avoid getting that. So it's a 2-shot regimen and is very safe, has not been associated with any bad outcomes in people who live with MS. So we definitely recommend it. And after I've had it on my to-do list for a while. Once you're 50, you're eligible for it. And so they recommend everyone over the age of 50 get the vaccine, and in particular for our MS patients.
Yeah, no, I totally agree. The new vaccine is much more effective than the old version, which was a live virus vaccine. This one is not. It's safe. I will say buckle up when you get it. There's a lot of post-vaccine myalgia or muscle aches. People feel pretty crummy, and their arm really hurts. I mean, it really hurts.
Really?
Days. So I would say just be prepared that that's not unusual. Whether you have MS or not, that is not unusual, and it will honestly go away. But those first few days, you're going to say, my goodness, what in the heck? But it's worth it. This is, I mean, anyone who's on this call and has had shingles knows this is no joke. It is painful and miserable, and you can have pain that goes on afterwards. So I think this is another important vaccine to get. It's safe and it's highly effective.
So I want to circle back to you, Nancy, for a second, because now we have another thing in the news that many of us are getting alarmed about, and that's monkeypox. So could you talk about, there's a lot in the news about the monkeypox vaccine. Can you talk about this in the MS community and what people need to know about this vaccine?
Yeah, so monkeypox really is very, very different from COVID. So, monkeypox is spread through prolonged skin-to-skin contact. So thankfully, not a respiratory virus, so is not, given through the air. It's really skin-to-skin contact. So that in and of itself should be reassuring that the transmission is going to be a completely different process. Now, that said, cases are increasing, and here in West Hollywood, we have a large outbreak, and it is something, especially in the LGBTQ community, that people are very concerned about. And the availability of the vaccine is somewhat limited. But there is a vaccine that's effective. It's called Jynneos. I think that's how they pronounce it. The difficulty for people who live with MS is this is a live vaccine. So, just like what we got for smallpox, you'd get a little blistering effect from the vaccine, but this is a live vaccine. So in general, we don't recommend that people who live with MS are vaccinated with live vaccines. And in particular, if you're on a highly effective or immunosuppressing medication, that's because you could develop an infection from the virus itself when you're immunocompromised. And I think in general for MS patients, we worry that the live vaccine could potentially trigger a relapse. So I think in general, it's not something that we would automatically say that everyone should go out and get. It's definitely going to be in high-risk populations, people who have a high risk of being exposed. And then you'd have to take into account your particular situation in terms of your immunosuppressing medications and so forth. But again, I want to emphasize that monkeypox is not COVID. It is not going to be the kind of pandemic that we've seen in the sense of, the numbers of people getting infected. That said, it's serious. And I think we do need, the way out will be for the vast majority of people at risk to get vaccinated. So we'll see. And I'm hopeful that our public health folks have learned something from the COVID crisis, that we will be better armed against it. So I think if people have individual questions about this, should definitely speak with their primary care physicians and their local health associations, or the public health in around, especially here in California and Los Angeles, have really ramped up their messaging, and you can find out where you can get the vaccine and so forth.
Thank you very much.
So there's a couple of questions that came up specific to the S1Ps and some of the data out there that people are not generating an antibody response to the COVID vaccine, and they're concerned. Now, perhaps you can help us understand the antibody response and T-cell response, and some of the questions are, is it worth getting this, the boosters, because I'm not generating a response? I mean, how many shots is it going to take me to get a response? So what are you saying to your patients who are on these types of drugs?
We still recommend that people get vaccinated. There are lots of immune responses to vaccines. And we know from the B-cell depleting agent data that even though antibody levels are not rising, T-cell responses are stimulated. And that's good news because the T-cells are what keeps you from having more severe disease. The antibodies are to protect you from getting infected potentially in the beginning or to help with the infection, keep it under control. But the T-cell response is sort of the second wave and the second punch that really keeps the infection from getting too serious. With the S1P inhibitors, we don't necessarily see those T-cell responses in the same way that we do with the B-cell depleters. So it's not unreasonable to say, well, geez, maybe there's no point in getting vaccinated. But I still recommend that people do it for two reasons. One, there's probably some things going on that we're not measuring with these very simple immune tests that we're doing. And then number two, you definitely are a candidate for Evusheld, and at least here in Los Angeles and at our facility, you have to be fully vaccinated in order to be eligible to get the Evusheld, unless you've had anaphylaxis or some other response to the vaccine that precludes you from having it. So it's worthwhile going through and getting the full course of the vaccine so you can be eligible for Evusheld. But definitely recommend those S1P inhibited patients talk to their caregivers about getting Evusheld. And it doesn't matter how old you are. There's no age limit on that. It's just whether you're on one of these medications.
Can you just clarify, Nancy, what you mean by fully vaccinated? I mean,
yes.
Is it the first two?
Yes, so it's a different regimen depending if you're immunosuppressed. So if you're immunosuppressed, your first series is 3 shots. And then following that, 4 months later, you're eligible to have a booster and then another. If you are immunosuppressed and if you're over the age of 60, you are eligible to get boosters. So not everyone is eligible to get boosters, but our patient population, if they're immunosuppressed, should be able to get those. So theoretically, there could be people on the call who've had five vaccinations. If they got the 3, and then they could have had 2 boosters already, given the amount of time that's gone by. So that seems like a lot.
Yeah, we're talking about a lot of vaccines today. So
yes.
So Nancy, is there ever a time when someone's risk factors are such that they may want to talk to their neurologist about a different disease-modifying therapy in lieu of the vaccine response, or is that going over the top and you should stay the course?
Well, I wouldn't want to say 100% it's not worth a conversation. Certainly it's worth a conversation. Again, I would emphasize if it's someone like that, hopefully they would have access to Evusheld. And then also we've talked about how we have therapeutics now for people who develop, who have COVID. Either if they're inpatient, they can still use the remdesivir is still used as outpatients, the Paxlovid. But I think we would really have to look at the whole totality of the patient in terms of their risk for MS disease progression. And a lot of times the people who are on the highly effective therapies, that decision comes down to they should probably stay on their disease modifying therapy, but institute these other things that we've talked about in terms of having Evusheld availability and being cautious, and then getting early access to any kind of therapeutics if they do happen to develop COVID.
Thank you. Is there anything new from the National MS Society's COVID recommendations? Is there anything that's an update that people should know about?
We have modified our advice multiple times as things have come down the pike. We've just recently made some very subtle changes to be more for clarity's sake in terms of what the optimal timing is from the time you've had your B-cell infusion to when you get your vaccine. And the optimal time, of course, is 5 months because you're going to then have a month to get the good vaccine response before you get your next infusion. So we try to make that more clear, but that's a little tweak. In terms of what's coming down the pike, we're meeting again this month, but we'll definitely will be recommending that people get the new bivalent vaccine that will be available, the one that will protect you against the old versions of COVID plus the Omicron variants. And I'm really hopeful that there'll be good uptake of that vaccine so that we can avoid another one of these winter surges. I think given the widespread herd immunity to a certain extent that we have developed over the last year or so, or 9 months with the Omicron, I think that could be the 1-2 punch, but of course we've all been proven wrong. But when we think about all the other things that happen during the winter, people get the flu and so on, we want to really go into the season as best prepared as possible. So I'm sure we'll have some new advice coming out about the new booster that's going to be available.
Great. Thanks. So everyone should really, and I have a slide coming up about resources in a couple of minutes, and I believe that the National MS Society will be up on the screen for that resource. I think it's also important that if people are concerned about, well, I'm on this drug, is that a problem? Or I'm on this drug, that information is in those recommendations, correct? I mean, the B-cell depleters and what they are, and as well as other drugs. So I think there's always lots of questions. Well, what about the medication that I'm taking? So that information can also be found. Is that correct?
That's right. We make a specific call out all the different medications so that you can look and see. But again, just to simplify it, the vast majority of medications that we use to treat MS do not interact with the vaccine response and do not increase your risk for severe COVID. It's really around the B-cell depleters and the S1P inhibitors, those two categories where we have very specific information to offer people.
Okay, thank you for that. And I dropped off the call for a little while. Apparently I had not updated I'm in a hotel for a couple of days and I had not updated my internet access, and it knocked me out. I had to pay my bill. And I apologize for that, but I don't know if you all talked about Paxlovid. And if not, if we could, particularly in terms of this rebound that we've heard with, let's see, Fauci and the president, and what's happening here. And maybe you've already covered it, and I apologize.
No, we haven't covered it in any detail. We've mentioned Paxlovid as something that people should seek out should they be infected. So it is those two gentlemen have one thing in common, and they are rather elderly. They're both in great health, but one of the issues is, do we need to give Paxlovid for longer? And there are people who think that course should be longer than it is. Clearly, we've seen that you can get rebound infection. So I think the important thing to know about that, I'm not recommending that people take it longer than what is meant to be prescribed because we don't have all the data on that. But just to recognize that can happen. The good news is even the rebound symptoms typically are minimal. It's more that you start to test positive again, but you don't necessarily feel sick. And I think President Biden was a good example of that. But it does make a concern that you could potentially infect other people with the rebound. But in general, I think just being aware that that's a possibility.
You guys froze.
People who live with MS could be at a slightly increased risk for that. Am I still frozen, Kathy?
I hear you, but your image is frozen. So I'm hoping others hear you as well. I'm not sure what's happening.
It's all you, Kathy.
I swear.
Nancy, you're alive and well, Nancy, and we can hear and see you fine.
I think there's a ghost in Kathy's room or something.
I think so too.
Anyway, so I think just being aware of that is important, especially if there are other people in the house that you don't want to expose. But it does sort of lengthen the time that you have to be isolating. But it's not as common as we would think from the news media, and it seems to be among certain people that are at risk for that.
Excellent, thank you. So I think we're getting close to the top of the hour. We've answered a lot of the questions in the question box. However, if your question was not answered, I apologize for that, but you can contact us. And this happened the last time we had a COVID update, and you can contact us through the Can Do MS website. You can ask a question, and I can tell you that Sarah will send them to the three of us, so that you will get a response as if it was live, but we are happy to do it in the next day or so. If you have a question that wasn't answered, or something comes up and you think, oh my goodness, I wish I would have asked that, please do. We're more than happy to answer questions. This is a tough time and it just keeps going. One of the questions I will mention is, are we going to be doing this forever? I mean, this mask thing and the social distancing, are we, for the foreseeable future, we're doing this. And hopefully it will settle down and we won't, but I think for now we have to just unfortunately buckle up and do it for our own safety. Anyway, there are some resources here on your screen. As I mentioned, we would have the National MS Society, and you can see that you can go directly to, utilizing this URL, you can go directly to the COVID-19 information. If you can't scribble it down quick enough, this will be available in a recorded version, and you can just go to the National MS Society and in the search bar put COVID-19, and I assure you it pops right up. You can also look on the CDC, which gives you general guidance, and that is very up to date, the NIH, and also, the New York Times really does a beautiful job with their COVID updates and their explanations. I have used it often to help with just explaining things. So I highly recommend any of these resources, and I wish you all well. I'm going to turn things back over to Sarah. Thank you, Nancy. Thank you, Roz. Thank you, everyone, for joining us. And my guess is we'll be back. And so, Sarah, take it away.
Thank you all so much for joining us, and thank you, Nancy, Roz, and Kathy, for that amazing overview, and thank you for arming us with so much good information as we're sending kids back to school and we're heading back into the fall and winter seasons here. So thank you for arming with all that information. We appreciate your knowledge and sharing your time and knowledge with us tonight. So our next webinar is coming up, and we'll be talking about pain. So tune in for our next webinar Wednesday on September 7th. And also, we encourage you to stay connected with Can Do MS. You can follow us on social media for updates on our programs, resources, and all of the latest MS news. You can also register for our monthly e-news series by visiting our site at candoms.org. And for those of you that are attending live tonight, you'll see a survey appear up on your computer screen. We'd really love it if you'd take a moment to complete the survey and share your input. Your feedback really helps us to continue to improve our webinar and our series. Thank you so much again for joining us, and I hope you all have a great evening and a safe fall. Thank you.
Thank you.
Everybody.
Bye, everyone.
Bye.